Dear colleagues, this is a case of soft cataract grade 2 plus, and staining the anterior capsule with trypan blue, washing it out, and then placing viscoelastic inside the anterior chamber and start the capsulorhexis with the grease saber 25 gauge serrata tip. And that's pretty easy thing to do. It's round shape capsulorhexis, enlarging it a little bit, and that's the end of that maneuver. Try to take the flap out. Doing the hydrodissection, a little bit hydrodelineation there in the periphery, enlarging the paracentesis, and then using a long chopper, I'm doing the horizontal chop. It's a pretty easy maneuver, and it's the second one, it's the lateral chop. Having now one heminucleus divided into two, it's very easy to access the pieces inside the bag and then manipulate it and aspirate it to the phaco needle. More chops, so we have smaller and smaller pieces, and to be fast aspirated by the phaco needle. Taking out the rest of the nucleus, and then what's left is a thick layer of epinucleus and cortex, which are the epinucleus. It's easy to get aspirated by the phaco needle. And then for the last part underneath the main incision, I use the irrigation aspiration pieces. Placing the irrigation piece through the main incision, I place it in a lateral way so I can block the incision and not lose the pressure into the anterior chamber. Would be nice if the patient will be more cooperative, but it's a part of the surgery, so we enjoy it also. Taking out the last chunk of epinucleus from the right side of the eye, and getting some traction on the iris, so it's released from the incision, and finishing up the cortical and epinucleus removal, polishing a little bit the posterior capsule, and then under irrigation I'm gonna implant hydrophilic Sifi IOL inside the bag, and that's nice IOL. It's unfolding, it's get very nice and stable inside the bag. Those are in a preloaded shape, so it's saving time a little bit more, and have a small shaft, the cartridge, so you don't have to enlarge the main incision. Pressing down the iris root to release the anterior synechia, and washing out the viscoelastic and anything else from the anterior chamber. At the end, I will place a air bubble and finish up the case. Thank you for your attention.